There are some patients who are very skeptical about, traditional or FDA-approved medications, and I certainly understand that. If you Google these drugs, there's a lot of information out there that's hard to digest, and I would encourage you to speak with your healthcare provider about these, because of the side effects listed for most medications, you have to really drill down into how many patients that actually presents in. And so we have the software that can actually show you a percentage of patients that actually experience those side effects. The other is experience in dosing. And so some patients may have a negative experience with one provider in that they were, suboptimally managed. The dose wasn't high enough, or maybe they were dosed too high. And so that can greatly affect how people respond to medication and what that experience is like. I think we're also lured into this false sense of security when we stamp all natural on the bottle. And that's this tendency, right, is to go into a more all natural approach. And the problem with that I have is that these supplements are not well studied. Oftentimes we don't know what the active ingredient is in them. The funding for the development of them is very low. And I think sometimes they capitalize on this. These manufacturers, they put all natural on the bottle, and they're hoping that you correlate all natural with all safe. And that also is not necessarily true. I remind patients that, mercury and cyanide are all natural, lead's all natural. You certainly wouldn't consume those. And so, I think some of us are spending some more time learning about these supplements, researching them. The knowledge as far as allopathic physicians and osteopathic physicians probably isn't there when it comes to some of the more natural drugs, and I think those of us are spending some more time educating ourselves on those. But what I tell my patients is bring in some information about the medication. We can even go over the articles, the research that they're claiming, and many times I can poke some pretty sizable holes in those, and I can show patients how these medications that claim to be studied really aren't being studied. A lot of supplements are safe. There are ones we're learning about, so I'm not discounting the entire group. But what I would say is, if it sounds too good to be true, and there are wild claims about incredible results in a very poorly written study, that would set off alarm bells.